Dr. Cal Cooper, neurosurgeon in Austin, Texas. I practice with Austin Brain and Spine. In my practice, I see all manner of neurosurgical patients. I treat everything within the brain and spine, focusing predominantly on patients with vascular problems within the brain and spine. I see patients with aneurysms, arteriovenous malformations, arteriovenous fistulas, which are irregular connections between arteries and veins. And then I also see general patients that have things like tumors, as well as degenerative spine and other spinal problems. Many of the procedures we perform are becoming less and less invasive, one of which is a less invasive way to access vascular problems in the brain and spine. I do a diagnostic cerebral angiogram, an initial workup for patients who have these vascular problems so that we can better understand the most effective but least invasive approach. So sometimes we'll do several tests prior to even doing a treatment so that patients know all of their options, whether it's a more invasive or classic approach versus a newer, less invasive approach. So here at Austin Brain and Spine, I feel like my partners and I really try and focus on the patient as a whole. I think we try and isolate their problems and really try and understand where they're at, what their understanding is, and what they really need. I think that sometimes, even though we're surgeons, we offer a lot of non-surgical counseling and care, and I think that's a very important part of our practice, and that's what helps distinguish us. I think that we're very thoughtful in our approach. We treat patients as though they're members of our family and really try and guide them and hear them for where they're at and what they need, and sometimes that's surgery, sometimes that's not. So we really feel proud of that approach to medicine.